Bible be? Showing only on Hope Channel Ghana, your preferred Christian TV station.
Welcome back to the consulting room. We are having a very extensive discussion on the menstrual cycle. We've had a bit of discussion on menopause as well today. We've spoken a bit about premenstrual syndrome. We've spoken about intermenstrual bleeding, the safe materials, the materials to use during your menses, and we've spoken about a whole lot. And there's one thing that my teacher says: if he has a class and you don't ask questions, it means you understood everything or you didn't understand anything at all. And well, our viewers do have a lot of questions. I hope with the amount of time we have left, we'll be able to address as many as possible. So some of them have been addressed. So I'm sure for those people, their questions we won't repeat them, but then for the ones that we've not addressed them specifically, we would talk about it. So our first question is, please, good evening, Hope TV. Please, I want to know more about menstrual irregularities and the side effects of continuous contraceptive or family planning method. I'm sure on the menstrual cycle. Is there an effect of family planning or contraceptives on menstrual cycle?
Yes. Not to discourage anybody about family planning. Family planning is actually safe. It's life-saving. It's life-saving. I've had bad experiences where people, because of lack of family planning, unfortunately, some of them, we lost the mothers during childbirth. So it's really good. But then, and there are various forms of family planning. So if you say family planning, it's a big thing. Abstinence is family planning.
Yes, that's the best for somebody that is not married.
Exactly.
Recommended, stamped by everybody.
Exactly. We have the barrier method where you don't take in anything. That's also a form of family planning. But the one that has effects on the menstrual cycle is the hormonal, the pills that we take in. They are hormones. We mentioned that the menstrual cycle is regulated by hormones. So if you take in these hormones, they can cause some changes in the menstrual cycle that can be that are tolerable. You can deal with them. But then if it becomes so severe, maybe after some months after taking some of these pills, some are injections, you are bleeding too much. And bleeding too much, the last time we explained it, where you have maybe palpitations, you can hear your heart, symptoms like your heart is beating so fast, you are feeling dizzy, you easily get tired, then you have to go back to your family planning provider. You talk to them, then they may switch you to other methods. You see, nobody... I have a lecturer who will tell me that when people come and they say, I'm afraid of family planning, he asks them, have you ever seen somebody die of family planning before? It's rather pregnancy that if it's not planned, it can end your life. So family planning is good. It's good. But then, as I said, it's rather the hormonal ones, the pills, the injections, that may alter your menstrual cycle.
And that can easily be fixed.
Exactly. So you go back
it's just like taking any drug, I guess.
Yes.
If you have the side effects, you go back to the doctor.
Exactly. Then they may switch you, assess you. It may not even be from the pills you are taking. Then they may switch you. So yes, it can have effects on your menses. And the person also asked about the irregularities. We spoke about it at length last week. That if it's irregular, it can be the absence, which can be normal as a result of pregnancy or as a result of something else. We spoke about bleeding too little or too much. So yes, those are the irregularities. And if you see any of them that you think is abnormal, and the best way to know that it's abnormal is for you to track your menstrual cycle. If you track it and you are sure that this thing I'm seeing is abnormal, please go to your doctor, see your physician.
So,
actually, some of what we are calling the hormonal, the family planning pills, I actually used to correct some of these menstrual irregularities. And so when Dr. Abigail was stressing on the importance of family planning that is very necessary. You see that most women don't consider emergency pills as family planning. They will easily take that and not want to do family planning because family planning can kill them. But the emergency pill is what will actually cause more irregularities and cause a lot of issues because you are giving yourself a high dose of hormones at once. So it's good and it's... So don't be worried if you come to the hospital and we put you on some of these hormonal pills when you've come with issues. It's not that it's bad. Sometimes we use it to actually correct these ones.
Okay. So to our next question. The questions are plenty. Brace yourselves. Please. Hi, I love your program. It is so educative. Thank you. My question is, does seizure of menstruation lead to menopause? I think we've discussed it.
Yeah.
It depends on the age.
Yes. Because we have abnormal menopause, and I mentioned them.
Yes.
If you are less than 40 years, then that is premature ovarian failure. Yes. So when it ceases and you are between the window period, between 45 to 55, then that may be your menopause.
I think even though you are in the window period, you can actually still be pregnant.
Yes, yes.
Because
so you should check.
Yes, even though you are
sexually active.
Let's move on. The question is our next question. Please, doctors, after fibroid surgery, can it change your menstrual cycle?
Yes, because we've touched the uterus. So it can.
And usually
you can actually
the fibroid surgery is to correct any irregularities.
Exactly.
So if you are correcting it and the irregularities are being corrected, it can change. Yeah. Well, dear viewer, I hope you understand. Someone says, I have a friend who was pregnant, yet had her menses for 3 months. In the 4th month, she didn't have the menses, and when we checked, it was pregnancy. What could be the cause? I think this thing happens a lot. A lot of women say, me dena me menses intina me nimse menyem. Okay. What's the cause?
I can say that one. Some people don't even know how to date their pregnancy. So it can be that 3 months she said she was seeing blood, she was not pregnant. So that's one thing. Some people, that's why the moment your menses cease, you go to the hospital. Even if you know you are pregnant, go to the hospital so that your healthcare provider can help you date the pregnancy too. We have what we call the implantation bleeding, where at the very early stages of pregnancy, where the baby is attaching itself to the uterus proper, there can be some bleeding that you may see as menses, especially for women that are not heavy bleeders. And sometimes it can be an early pregnancy bleeding, which is not normal. But most of the early pregnancy bleedings can lead to miscarriage. Some can be managed and you'll be fine. So maybe that woman was having early pregnancy bleeding and good for her, she did not lose the pregnancy and she's been able to carry it past that 3 months. So if that's the case, I think you should see a doctor. Yes, for you to be properly assessed and determine whether you were indeed pregnant within those 3 months or not. It was the implantation.
So just go to the hospital.
Exactly. Yes. But
go to the hospital. I don't know your name, but if you miss your menses, check. If you miss your menses and you are sexually active, don't lie to yourself. It is sex that will get you pregnant. It is unprotected sex that will get you pregnant. I know I'm making some people uncomfortable by what I'm saying. A lot of us deny the fact that we are sexually active. So unprotected sex will get you pregnant. When, yes, that's it. Unprotected sex can get you pregnant. So when you miss your menses and you're having unprotected sex, please check, at least do the urine pregnancy. Yes.
Yeah. It's just 1 CD also. It's so expensive.
I don't know how much it costs.
At the hospital, it's around 5 CDs.
Okay.
Yeah, but I don't know. The pharmacies, they are usually cheaper.
Okay. So on to our next question. It says, I had a miscarriage last month, and since then I have severe abdominal pains. That's the question.
This question is a bit open. When she means she had a miscarriage, did she go to the hospital? Did she take a scan? Because the thing is, the reason why I'm tackling it from this angle is that the term miscarriage is loosely applied, but it could be that not all the products, not all the parts of the baby came out.
Okay.
Sometimes we have something we call retained products of conception. So like there are still parts of the baby that are still in the uterus, and it will cause a lot of pain.
Okay.
Yes, miscarriage. Did she go and they said not all came out, so they had to do a D&C and brought the rest out, because that too can cause some scarring, which will cause pelvic pain. So it can be a whole lot of things.
Go to the hospital.
Yes, go to the hospital. The question is a bit open, and there are lots of avenues.
I think the conclusion for most of our questions
is will be to go to the hospital, because we can't address it. Yes, but we are just giving you an idea of what could have
so,
could be.
Oh, we have someone watching us from Lome, Togo, and the person says,
Hi.
It's been years now not seeing my menstruation cycle due to injection taken called Depo-Provera. It's taken every 3 months, but then she stopped 5 years ago and she's still not seeing her menstruation, and she doesn't know what to do again. What do I do?
Good.
She's 43 years and she wants to give birth again. So she's taking Depo-Provera for a while.
Yeah, so she took it for how long?
She took it for years. She didn't state how long, but she took it for years.
Yes, so bringing it to what we've discussed today, the issue with some of these Depo-Provera is actually a hormonal contraceptive. So it changes your cycle. It changes what happens. So even when you stop, yes, it can change. So even when you stop taking it, there are some things the body needs to readjust itself to your new state. So you may have the menses being irregular or being even absent, even though you've stopped. Unfortunately, too, she is nearing the age of menopause. So she can actually be in the premenopausal, if not
4 to 7 years.
Yes, so she may actually be premenopausal. So, but the only thing we can do, the main thing we can do to find out what's going on is for her to come and we can do some labs to see her hormone profile, to see if she's still producing enough, like FSH, if she's still producing enough hormones to trigger the ovaries and produce estrogen, like go through the whole cycle. If we go through and realize that all her hormones are intact from brain to the ovaries, then it means that she can, like other methods, other interventions can be made to help her get pregnant, to treat the infertility, but not infertility, but subfertility she's facing.
I want to also add that even menopausal women can now give birth. We have assisted reproductive techniques, so all is not lost. Yes.
So, hi, good evening. I'm really enjoying the topic. Please, what could be the cause of having a thick discharge in your vulva after menses? What could be the cause? I think some women have, so because of sometimes the discharge after the heavy flow, some people do a full antibiotic treatment every month.
Every month.
Well, I think the little I know is that after the blood, the uterus might still shed something that is not bloody. It could be slimy, and it's just the normal vaginal discharge. If you're expecting bright red blood and you are not getting it and you are confused, I think you should go to the hospital.
Yes.
But then for most of us, it's normal that you don't. It's not every time that you are seeing bright red blood, especially getting to the end of the cycle. And some people actually bleed their menses. I read last week, I did a bit of reading, it's 7 days, but then because they have up to 4 days of bloody discharge, they consider the last 3 days as they are, because they are not seeing
blood.
Yes, and red. Maybe they see some dark brown
they
discharge.
Call it discharge.
They think it's abnormal.
These antibiotics, please, if you are doing that, you can kill. Last Sabbath, I had the privilege to listen to a lecture on I think abuse. I've forgotten the exact name of the lecture. Yes, but see, please don't. If your doctor has not given you the prescription, don't buy it. In our parts of the world, it's easy for somebody to walk to a pharmacy, a drugstore to buy them, but it's not right. Please don't do it, okay? Because even the use of that, the frequent use of that antibiotic can even predispose you to vaginal infections that can rather give you the discharge you are even talking about. What you may be seeing may not even be the discharge. But you using the antibiotic every month can rather give you the infection you don't have, but you are looking for. So please don't do it. Don't do it unless it is prescribed. Don't.
Someone says, please, ever since I gave birth to my daughter, for the first 8 months, my menses came, and after 3 months, it stopped. Since then, I have never gotten a normal cycle. Sometimes a clot, and sometimes no menstruation for 3 months. Sister, I've never tried any family planning or abortion before. What should I do?
Go to the hospital.
Irregular. She's having irregular menses after pregnancy.
Yes. Sometimes during pregnancy, there's a lot of changes the body itself goes through.
The same hormones.
Yes. There are lots of hormones, and some of the organs in the body have to become bigger. Some will become bigger than the blood that supplies them. There's a whole lot of things that happens during pregnancy. And after pregnancy, these changes now have to revert to how it used to be. Some may not go to their pre-pregnancy stage. So sometimes some of these things, especially for such a person who has delivered, we really want you to come, and then we go through and check to see at what level the problem is. Then we help you with it. Then you stay at home and then self-medicate or something. So you can just come back and we'll see. But it's usually part of the whole pregnancy and post-pregnancy.
We have a question from Michael. I think he's the first male sending us a question. Well, he's the first male mentioning his name and sending us a question. He's from Anomabu, and he says his girlfriend's menstruation comes twice in a month. Why?
Oh. Last week we mentioned that the menstrual cycle length is between 21 to 35 days. So if you are, maybe your menstrual cycle length is 21, which I always use as the example, you may bleed on 1st, maybe January, and it will come again on 28th January. It's normal. 28.
2nd. 21 days cycle.
Yeah, 21 days. Thank you very much. Even for a 27 days cycle, you may see blood on 1st January and on 28th January. It's normal. It's normal. So it depends on the lady's cycle length. Yes. But if you have really monitored your cycle length, I'm stressing it again, please know your menstrual cycle, know it. If you've really monitored it and you know that it is less than the usual number of days you have your menses, and you know that it's not as a result of any stress, change in diet, change in environment, just go to the hospital. Even if you think it is as a result of some of these things, just go. We run with you some tests and tell you are normal, than for you to sit at home and at the end of the day it may be something abnormal. So Michael, please, it can be normal. Thank you very much for showing interest in women's business. Thank you, Michael.
So another controversial question, and I was expecting it to be asked. Is it good? One of our viewers asked it today. Is it good to have sex during menstruation?
Well,
please, from the medical point of view, is it bad?
At this point, I'm a medical doctor.
Yes.
Speaking as a medical doctor.
Yes, please. Disclaimer.
There's actually no contraindication. There's nothing medically restricting it. Yes.
But our culture.
But for that, I'm not going to tackle that. But medically, there's not really any reason not to. The worry will be that you may introduce an infection, but it's not really.
It's not been proven.
Yes, like, I mean, if you can withstand it medically, if you can withstand that, there's not much against
a personal
it.
Choice.
Yes.
Dr. Abigail, do you have anything to say on that?
I think I'll start with Amma. Yes, there is no medical contraindication to that. It depends on you, the man, and the woman, and what you believe in. So if you are okay with it, then you can.
Okay.
That's what we can say.
Yeah.
As a move very be saying.
No. But we have to.
This should be a personal. It should be a personal decision.
Yes.
Like, it's really subjective.
Because the truth of the matter is, actually, during the whole menstruation, especially the period, that's when because of the hormones that are going being fired all over.
Let's answer 2 more questions before we run out of time. So the last 2 questions that have been sent today, and sorry viewers if I've not been able to get to your question, but we try to address most of the questions through the discussion. This person says, when I'm menstruating, I throw up and feel a lot of pain in my abdomen. What can I do to stop it?
Last week we spoke about dysmenorrhea.
Yeah.
And we mentioned that we have the primary dysmenorrhea and the secondary dysmenorrhea. So the primary dysmenorrhea is usually a day before or the first, maximum the second day. That's the primary dysmenorrhea. And I mentioned that if pain is subjective, so one, if you can really tolerate it, then I'd advise that you go through it. But then if you can't, or perhaps you have a very important program coming up, you have an exam coming up, it's advisable that you take maybe some painkillers. And from experience, I've realized that these painkillers usually work if you take it before the onset. Usually when the pain starts and you take the medications, it doesn't really help. So you should know your cycle and you know that, okay, around this time or on 22nd is when I'm expecting my next menstruation. And I have an exam around that time, so I'll take the painkiller. So that is one aspect. You also have stress relievers where you relax more, you are not so much stressed, you exercise, you eat well, eat good meals, you avoid alcohol and caffeine. All these can help manage dysmenorrhea. That's the primary dysmenorrhea. The secondary dysmenorrhea are usually as a result of a disease that is happening in the uterus. Yeah, so for that one, if it's so severe, then you have to see a doctor. But for symptoms like throwing up, nausea, and all of that, you can manage it. But then if it's too much, we even have medications that we can give you to minimize some of these symptoms. Okay. Thank you.
So our last question. A friend had her menses, and after 2 weeks, she took the COVID-19 jab. She has been flowing for more than a week now. She went to see a nurse, and she was told the bleeding is as a result of the jab she took. Doctors, is this true? Is she safe?
Okay, this is actually very controversial, but a very important question. COVID is something we are all still going through. Yeah. There's a lot of literature coming in. There's a lot of things we are discovering about it. For all you know, you may be the reason why we'll discover something about COVID in terms of menstruation. Some of these things, I would advise that you come, there are gray areas. It can be something that was already on its way. And then it has, you may have developed another pathology in your uterus which is causing that, but it has coincided with the COVID. I've had issues like this. People will have the jab and have breast pain, a whole lot of things. So just come to the come to the hospital. Let an OBGYN, an obstetrician assess you. A gynecologist, assess you. And then let's make an informed decision together about your diagnosis and everything. Okay. Yes.
So we are almost coming to the end of today's show as usual. We've had almost an hour of a very interactive talks. What are your last words concerning the menstrual cycle and menopause and all that we've spoken about?
Menopause is really normal, please. If you have your old women in the house and they are going through some of the symptoms we mentioned from the beginning of that presentation, our talk, please, they are not witches, we beg. Rather be supportive, encourage them, and show them love. That is when some of these symptoms, some are psychological, and if they have good psychological, social support system, it can help them ease some of these symptoms. So menopause is really normal. Last week we said menstruation is normal. Today we are also saying menopause is normal. So please, men, understand and support your women.
Yeah. Thank you very much, Dr. Amwa.
Yes, my final words are that I hope from all the discussions we've had, men have this seen how precious we are as fresh, because we go through a lot, right? From menstruation to menopause, you don't get a break.
It's not easy.
It's not easy. So try and understand that sometimes when we talk a lot, it's a whole lot. So it's either we're in too much pain or a whole lot of things. Even when it stops, it's like you're having a lot of problems, all these hot flashes and all that. So I hope we are all understanding towards women, because they actually go through a lot. And women, please, let's know our cycles and try and have a good health-seeking behavior. Come to the hospital. It's not a scary place like that. Come and let's make sure everything is fine than staying at home and self-medicating.
Okay. Thank you very much, doctors, for joining us today. My last words, or plenty words before the last word, is that this program is repeated on Saturdays at 3 p.m. and Tuesdays at 1 p.m. So if we went too fast or you didn't catch the whole gist of the show, you can always watch the repeat, or you can go to our Facebook page, the Hope Channel Facebook page, and you would have the recorded message over there, and also the YouTube channel would have the recorded TV, the recorded show over there. Also, this is just a friendly reminder. COVID is real. It's still with us. We are getting to the festive seasons. You might think you are okay, but you might be a carrier who is asymptomatic. Kindly wear your mask. Continue social distancing. Wash your hands well. Keep yourselves well, so that you don't give it to somebody that is vulnerable, so that we'll all be able to see 2022 and in a very happy state. And I hope that next week, Monday at 8 p.m. as usual, you join us in the consulting room, and we'll be very happy to have you. It's been a very wonderful evening. Have a good evening.
Hope Channel, changing lives.
With all your troubles, acknowledge His presence. He's going to do it for you. Bisa Yesu kwa, bisa no na bayo, ya risama wachinchia. Do ya Oh